appeared for a minute that it might not go.
Thank you, Madam Chairman, and thank you all so much for coming here today. This is such an important topic, and having been a small business owner, I can remember the struggles of trying to fund a health care plan. I got up to 50%, but only for the employee and not for the family. Didn't cover the families. They had to make up the difference for that, and that was unfortunately the best I could do. Mr. Wordsworth, if I said it right, you said something about in your testimony about that you don't think that the government, and I might have misinterpreted this, ought to have incentives for the individual to steer them away from an employer-based system. Am I right in that interpretation, or did I get that wrong?
No, that's just what I did say. If the government has a program, and there are discussions about the government either having an insurance company or having government programs, if those programs or any kind of government incentives took it away or actually paid employees, you could have paid by reduced premiums or whatever, away from the concept of employer-based insurance coverage, I think that would be damaging to the system.
Okay. Well, I'm just, and maybe somebody else might want to comment on this. I'm not clear on why it would be damaging. If we gave tax incentives, say, to the individual to purchase their own insurance, to make their own decisions, and not to be reliant upon the employer, what do you think would be wrong with that?
If they were incentives to the individual, I think that would require a little bit of study, and I don't feel qualified to speak on that very question.
Okay. Would anybody else like to comment on that? Yes. Mr. Nicholson?
Are you talking about individuals being mandated?
No, individual, just giving tax incentives to the individuals, maybe even tax credits to those who don't have the capacity to purchase insurance due to their income. But shifting from an employer-based system to an system whereby the incentive resides with the individual. It could still reside with the employer, but right now we really don't have incentives to the individual to purchase their own insurance. And maybe if any of you would like to comment on that, please.
I think it's a grand idea. We looked into it and tried to figure out a way to do it. The problem, of course, is that our youngest employees would much rather spend $120 a month on beer than on health insurance.
No question about that.
I would say that the problem that my concern is who is going to control the increases in the insurance. We need a long-term solution. So I think it's not those tax credits are not going to be the real solution. The prices are going to increase eventually.
So let me just say, I think the problem with having a public option is that what happens in everything in Washington is the government just runs red ink. We just borrow, and that's how we fund it. And so somebody else is paying for it. But I do think that there's not competition in the marketplace right now because there's not transparency and there's not an apples-to-apples comparison. And maybe the exchange issue will help with that. Anybody else like to comment? Yes.
I will just say
myself. I don't see a huge problem with having a system similar to the one that the federal government uses for its health care program, because there is a group that goes out on the marketplace and bids on contracts to cover various aspects. Even that has been increasing, I know. The other issue is that what we've been talking about today doesn't necessarily cover the problem that occurs when an employee leaves a particular job for another one, or either because they choose to and they're going to a new employer, or because they've been laid off because of the economy. And, you know, one of the issues here that we've been talking about today is that in small businesses dropping the coverage or delaying hiring, that is going to prevent our economy from recovering, and that's something that we need to do right now.
A supply officer, And those of us,
I think we are generally agreed that well-being, taking care ahead of time, is an ultimate goal. I'm not sure that as a small businessman I can perform a nanny service on just a few employees. Now, if I had 150 or 200, I could afford to get a gym facility, that kind of thing. So I think if we're going to shoot toward wellness coverage, which makes a great deal of sense, I think we've got to really figure out how to get the individual assistance worked out properly.
Thank you very much. Thank you, Madam